Now, let's take a look at the vestibular system. Oh, that's the sense of balance. That's where we get our equilibrium. Remember, he's floating in amniotic fluid, okay? And the fact that gravity is sort of working with him while he's in utero, because gravity isn't going to be his friend when he gets out and gets in our nursery. You know, remember that when he was in utero, his movements are nice and slow, okay? And he is in control, and he doesn't, you know, have any sharp or sudden movements. They're just all smooth and they're sort of consistent, okay? And the forces of gravity are working with him. But then, of course, you know, when we're looking at that vestibular system, we have to also take into account that, you know, we're looking at the sense of balance and we're looking at equilibrium and so forth. You know, that amniotic sac, that uterine wall, all of that is helping him to maintain one's balance. When he gets to us, doesn't have that anymore. So we are the ones that are going to have to help him maintain that sense of balance, keep that equilibrium there, and to help to coordinate his movements and to help him overcome the gravity that has such a negative impact on him in our unit. Now let's take a look at that vestibular system. It's fully functional at 21 weeks. It is very highly sensitive to abrupt movements and position, okay, and actually can be interfered with until about 34 weeks. So, you know, rocking in most instances is better tolerated after 34 weeks. Many of us have spent a lot of money on rockers in our unit. I'd highly recommend that you just walk over to labor and delivery or over to the mother-baby unit and take some of their bath blankets and sort of put them under the rungs of the rocker. That keeps mom from wanting to do that ever more rocking, because there's not one of us anywhere around that when we sit in a rocking chair that we're just not going to rock, rock, rock. And some of our infants do not do well with that, and we need to be keenly aware of the fact that that infant that is less than 34 weeks may have his equilibrium disturbed. And we also know that when we pick up our infants or we move them suddenly, that handling also is inappropriate. It does cause him to lose his balance. It does cause his equilibrium to be off. And remember, it takes him a little bit of time to recoup from all of that. The next slide is one that I know a lot of educators use, and it's called the preemie flip. What one thing can you do in the nursery that will disturb equilibrium any more than the preemie flip? Here is this infant who is lying still, and we come up and we pick him up and we turn him over, all right? And we just flip him over. You know, it's sort of like he is, you know, a steak on the grill. We're just going to pick it up and we're going to turn him over. He really doesn't respond to that very well at all. He actually, the state of equilibrium or balance is totally disturbed, actually may be disturbed for over 20 minutes until he can actually self-organize and get himself together. Some people say that this disorganization can last as much as 30 minutes. And, you know, he'll be, you know, we'll have some O2 desaturations. We will have some apnea and bradycardia. You know, we will actually disturb the blood flow, okay? So, you know, there is a lot of things that happen when we take and we move this child abruptly and quickly. And because, you know, it is threatening to the vestibular system. It does take him a long time to recoup. If this is something that we have to, now, I'm not telling you that if you have a line to come out or if you have this baby to extubate themselves, those are all medical emergencies that we're going to have to take care of. We may have to move this infant abruptly. We may have to move him quickly. And if we do, then that's what we have to do. But I do encourage you that once all of this happens, bring this infant back together. Help put him back together in that organized, physiologically flexed position so that he knows he's okay. And give him those things that are very important. You know, this could be where a firm, positive touch, you know, hands on head, hands on buttocks, giving him some foot pressure and so forth, getting his hands close to face and mouth. All of those things are things that we can do to help bring this infant back. But remember, it will take him about 20 to 30 minutes for him to reestablish the vestibular system and his sense of balance. Okay, let's talk about that appropriate handling and touch and the fact that our movements need to be slow and gentle. We need to have positive touch and we need to have containment for this infant. We need to cluster our care. We need to sit down and look at what needs to be done and to get that done, and then maybe allow our infant a period of rest. Maybe we need to give him a timeout. We need to have him to recoup because our main focus is to maintain equilibrium with this infant. Also, the fact that if we have inappropriate handling, we know we increase stress. We know that we increase overstimulation. And if we take and we look at some of Dr. Peter Gorski's studies, we can look at the activity of nurses at the bedside. This is an older study, I realize that, but I think it is so true because none of us ever realize how many times we're in and out of that incubator, how many times we touch that infant in the course of a day and disturb him. But if we take and we look at Peter Gorski's study with an average patient in the NICU, during their period of time they're in the hospital, they have 130 caregivers, and they are handled over 80 times a day, and that they are disturbed 132 times. And this has all been documented. I guess I'm trying to tell you, how in the world do we think that this infant is ever going to get any sleep and rest for growth and development? How many of us as adults would tolerate this? I remember after having my first child and after having my second child, I couldn't wait to go home. I couldn't get any sleep. There was always someone in there. So think about the deprivation that we experience when we are constantly awakened or constantly disturbed. Think about the deprivation that they must have during the time that they're with us. Let's look at the gustatory system, and that's the system of taste. And remember that taste buds are apparent during the first 8 weeks of gestation. Between the 13th and the 14th week of gestation, they actually can differentiate, okay, because taste buds and taste sensations are formed. And by 26 weeks, of course, that's really when they get into the fact of differentiation of taste and know, sweet from sour. Sucking begins in utero right around 15 weeks. And so therefore, it's one thing that we need to continue when the infant comes to us is the fact that we should have pacifiers appropriate so he can continue non-nutritive suck. And the thing is the fact that we know that sucking does help to bring about a calming effect with the infant. And we need to realize that by dipping a pacifier in sucrose, we may also get, some relief of discomfort that this infant may be having, and he may be able to settle down and to reorganize. Remember that things are bitter, he often withdraws from. And I challenge each of you to taste gloves and to taste the nipples on our bottles, because none of them have a very positive taste, and therefore sometimes nice to put a little sterile water possibly on our gloves, or to actually on our nipples put a little bit of milk so that his first experience is not with just the nipple itself. We also need to realize that, mom's milk can be used for oral care, and the fact that we can just actually use warm water, but the infant does respond very positively, and there are many units across the country that are doing this. We also know that we have to be careful with the drugs that we're giving our infants, if any of them are by PO, because of the simple reason that we need to look and investigate in our pharmacy so that we can have something that's much more pleasant tasting. And of course, we're talking about kids that are much more mature in our unit and possibly sort of on the track to go home. But we do need to be aware that they are still keenly aware of taste, and will withdraw from things that are not very tasteful to them. So be aware that pharmacy and you should work together very closely in order to be able to overcome some of the objections our infants have because of the taste of their medications. We also need to realize that our infants, enjoy the fact of the positive taste and that they can relate to those. So it's important that we, are aware of those things that interfere. From the very beginning, what's one of the first things that interfere with? Number one, we take a towel or we do something and we wipe off their face. The next thing is the fact that we may intubate them, okay? And maybe we won't. But the thing about it is the fact that how many of you have tasted, endotracheal tubes? How many of you have tasted the laryngoscope that goes down and then the ET tube? So, we start right from the very beginning creating some of the oral aversions that our infants have towards feeding. When we talked about the tactile system early on, we talked about the perioral area being very, very sensitive. And what is the part of the baby that we touch first? The perioral area, okay? Because we're wiping it, we're trying to establish an airway. We give it no respect that the infant had experienced in utero. So it's very, very important that when we are interfering with that system, that we maybe give him back his hands to face, and that we present something that's more positive than what we have been doing. Remember that we have that ET tube down. We may have a feeding tube down. We've got all of this tape. We've got everything else that is around our mouth that can interfere with taste. Notice the fact that here's an infant that is totally comfortable in his environment. He has his pacifier. He's doing what comes naturally and also ready to interact with us. Even though he has a feeding tube, he has a pacifier. He's taking care of the non-nutritive sucking needs that he has, and he is organized and he is ready for interaction.